guys, we're doing a side lying release for you now. This requires a spotter or a partner. You cannot do it alone. It's the third step in the 3 Sisters of Balance for spinning babies. So you would have had to already do your rebozo sifting or shake the apple tree. And then you would have also had to do your forward leaning inversion before doing this. You can repeat side lying release every 4 to 6 hours if you're using it for pain relief only. If you're trying to do the breech presentation protocol, you cannot repeat it. It has to be done in order. So, to do side lying release, you need a complete neutral spine the entire time, which means your shoulders need to stay stacked one on top of the other. And your knees need to be in line with your hips. The reason why you need a spotter is because without one you'll fall. You're doing this either off the you're doing this either off the side of your bed. You could use your couch. This is just a massage table. So Lindsay here is going to come closer to the edge, just like that. So technically her belly should be off the side of the table, which it is. And my job is to make sure that all of her body parts we listed are stacked on top of one another, which they look pretty good. And from here, she's going to drop this top leg over, and she's going to flex this bottom. So the key here with this, you know if you're doing it correctly, if the top leg just falls and doesn't touch the side of the table. If it brushes the side of the table or bed, you're not doing it correctly. You're not in a neutral spine. Lindsay is waving free over here, so she's good. She would hold this position for 1 minute, and then her spotter would help her with the top leg, and she would roll onto her back and lift her legs both to take pressure off her back. And then she would roll to the other side and do this again, but we're not going to do that. We're good. So side lying release is important because it releases muscular spasm in the pelvis, and it also increases pelvic mobility. You can use it for people who suffer pain with intercourse or cannot void urine entirely, even without being pregnant. Side lying release can also help relieve muscle spasm in men. However, there's no clinical research that says it does anything other than that for men. So I hope this was helpful. If you have questions, please ask either Jess or myself, and we can send you more content. Thanks, guys.